Hi, so today I want to talk to you about fluid retention, or otherwise known as edema or edema. Depends whether you're in England or whether you're in America, whether it's an O or an E. However, it's fluid, lymph fluid, not normally blood fluid, around a limb. It's often seen around lymph nodes. We see it in the arms, we see it in the upper arm, lower arm. We see it a lot in the legs, around the knees, around the ankles. Sometimes at the top of the legs, it's where the lymph glands are. And I often get people say, I've got lots of swelling, fluid issues. Can acupuncture help me? Well, this one's a double-edged sword because yes, acupuncture can help. It really is fantastic. However, when we needle into somebody who has excessive lymph fluid, there can sometimes be a side effect. That person can spring a leak. Yeah, it's one of those double-edged swords that it can be very beneficial because obviously it is literally draining it out. But it may weep for a day or two after your treatment. So therefore we may have to consider, do we give you the warning that this may leak for a day or two, just to be aware, keep an eye on it, make sure that there's no infections get in there, that you keep it clean and as dry as best you can. Sometimes people have found they need to bandage them or wrap them, or would it be best not to needle them altogether? And sometimes I've made that call, okay, we're not going to needle that limb. We'll needle the opposite limb, and if both legs are very swollen and full of fluid, I will needle more on the upper body and do maybe more lymph drainage massage on the bottom half of the body. And then I would normally teach the client how to do some lymph drainage on themselves over the course of the next couple of days to keep that going. And again, it's always best to give them some exercises anyway to prevent it furtherly getting going. But some patients, they find that they don't mind the wetness and the springing a leak, and they actually really like the benefit of having it drained. And we have seen in some of the milder cases where they don't spring leaks, but instantly they have found that their swelling has gone down from acupuncture because it lowers inflammation. It increases, lowers cortisol in the body and increases all the other hormones and increases circulation. That's not just blood circulation, but lymphatic circulation. So we have found it is beneficial. But again, it's a call on how bad they are because some do spring a leak. And it's clear lymph fluid. There's no blood in it. It's clear lymph fluid. So if you have lymphedema or you have extremely swollen and you want to have acupuncture, do bear that in mind. And the acupuncturist will need to maybe adjust how they needle, maybe trying to needle lighter, use thinner needles, or maybe make the call and not needle that area. This has been Thoughts with Points. Good luck with your fluid retention and keep moving. It's vital with fluid retention to keep moving. This has been Thoughts with Points. Take care.